Hello, family medicine educators. Colleen Cagno here, pleased to be presenting this faculty development video on effective clinical precepting. So I know you are all experienced at clinical precepting, but do you sometimes ask yourself at the end of a busy clinic, was I an effective clinical teacher today? Well, you are not alone. All faculty, no matter the years of experience, reflect on this and need reminders about what makes an effective clinical teacher. And yes, while all learners have different needs, clinic can be highly variable, and you yourself have your own life experiences and teaching style. There are several consistent themes in the family medicine literature to help boil it down to a few key concepts. Specifically, the most and least valued attributes of an effective clinical preceptor. At the end of this video, you'll walk away familiar with the secret sauce of do's and don'ts of how to be a better teacher in clinic. First, think of 5 words that describe characteristics of faculty while attending in clinic. Ready? Go! Okay, stop. Now, if you have extra time, consider pausing this video and discuss the words you came up with a friend. This presentation was inspired by an article published in the journal Family Medicine in 2005, where residents and faculty across the Mayo Family Medicine departments in Washington, Arizona, New York, South Carolina, Minnesota, and Florida were surveyed. 104 residents and 76 faculty. Study participants were asked to select the most and least important attributes among a list of 15. The list includes enthusiasm, availability, clarity, clinical competence, feedback skills, organizational skills, professionalism, well-prepared, scholarly activity, non-judgmental, respects residents' autonomy, sincerity, listening skills, practices evidence-based medicine, role model. The residents ranked their 3 most important characteristics as non-judgmental, clinical competence, followed by enthusiasm. How about for the bottom of their list? Well, in last place, residents ranked scholarly activity, then organizational skills, then role modeling. Faculty in the study selected clinical competence, followed by role modeling, then enthusiasm for the most effective characteristics, and they agreed with residents and put at the bottom scholarly activity and organizational skills. But, unlike residents, they included respects resident autonomy. In summary, there was agreement that clinical competence is among the most important attributes of an effective clinical teacher, and that better educators are those who demonstrate enthusiasm for their educational responsibilities. Both groups also felt strongly that scholarly activity has little importance in defining an effective educator, a finding that is consistent with other published studies on this topic. Wow, that is a lot of information. So feel free to pause this video here and take some time to digest or discuss, refill your beverage, stretch, and I'll be here when you get back. Ready for our residency program's results? Well, the 15, that's 9 faculty and 6 residents, who responded from the University of Arizona Family Medicine residency in the May of 2018 felt that the top spot was split evenly among enthusiasm and clinical competency, which tied, followed by non-judgmental, which had just 1 vote less. And these were identical to those residents who responded to that 2005 study. Well, the bottom 3, you probably guessed it, just like that national study, scholarly activity scored at the very bottom within our own program, then followed by being well prepared, and third to the bottom was actually a tie between availability and organizational skills. Interestingly, within our program, just as many people put organizational skills at the bottom as the number of people who put organizational skills among the top 3 characteristics to make an effective clinical preceptor. So in conclusion, our program ranked enthusiasm, being energetic, interested in teaching, having a positive attitude, enjoying your job and not complaining, equally with clinical competence, knowing how to manage patient issues, knowing the medical literature, and being engaged in CME. Followed by, at the top of the list, non-judgmental, providing a safe learning environment, being non-threatening, not belittling residents, creating an atmosphere where residents feel safe to admit what they do and don't know. While our program's results were slightly different in order, they aligned with the same attributes that the residents in that 2005 study put among the highest, and mostly aligned with those faculty in that study, except they rated role modeling higher. So in conclusion, if you're looking to become a more effective clinical teacher, be positive and watch your attitude. Keep learning and stay current in your clinical management and create a safe learning environment for the residents. Now you know the keys to successful and effective clinical teaching. Thanks so much for watching this video, and I hope you learned a lot.